Welcome to my world once again. Here is another journey on our knowledge. We are just trying to see how far we can go with acquiring knowledge that will better our health condition. Health is wealth, knowledge is power. The more knowledge you have about health matters, the healthier you will be. And if knowledge is power and health is wealth, you are wiser and more powerful. The topic for discussion, or the topic we shall be talking on today, is conjunctivitis. Conjunctivitis laboratory diagnosis. Conjunctivitis has already exposed itself. The definition is even clear. Inflammation of the conjunctiva. The conjunctiva is that membrane covering the white patch, the white area of the eye. And when you are talking of inflammation, you are talking of something that would create this more enlargement. The veins are now enlarged. More blood is now rushing to that area. More cells, all these defense mechanisms are rushing to that particular area, and that's what you now see as a pink eye. Because that pink eye, that redness that you see, is as a result of these vessels now becoming enlarged and allowing more of the defense mechanism to come into that area. Now we have basically three, but we can call it four types of conjunctivitis, the causes. That you have the one caused by allergic reaction, you have the one caused by bacterial infection, you have viral infection, and then the chemical splash too. The chemical splash is very common if you swim, go into a swimming pool, the chlorine and what have you, the chemicals now probably enter into your eyes, and the eyes reaction makes your eye pink, and that is what you probably will want to call having a problem, infection, or whatever you want to call it, conjunctivitis. But in all sincerity, that just needs a little saline washing, and the whole place, the whole eye will gradually become normal. But the ones that are staying for a longer period and they can even cause blindness are the bacterial type, which I shall dwell on, is where we shall talk so much on laboratory diagnosis. I remember a woman that is always prone to having conjunctivitis in the area I was living when I was very small. Every year in, year out, you find her having conjunctivitis, whereas I don't have it, and many people, but very few. There are seasonal conjunctivitis, which most time could be allergic type. There was a time that people even call it Apollo, that is around the period that the exploration of the moon just happened, and the infection came around that period, and they thought that the dust from the moon was what was causing it. But these are all myths. The real causative agents we know, because we are really exploring so much the conjunctivitis problem. Like I said, bacterial conjunctivitis will appear pus-like because the commonest organisms are pyogenic organisms, organisms that produces pus. So when you look at the eyelids and the surrounding, you will be seeing this yellow discharge apart from the little pinkish eye. That discharge is usually caused by Staphylococcus and the Streptococcus pyogenes, Staphylococcus aureus, and organisms like that. The viral type is also seasonal, so you may have probably during the very cold season period dust in the tropical area. We call it Harmattan period. You find people scratching their eyes, and at times the hands are not clean. They now use it to rub the eye, creating that injury, and then you find the Staphylococcus coming in to create that infection. You start that infection, and then you have the pus coming out because of the dryness of the eye. The tears that should ordinarily kill viruses and the lysozyme enzymes that should help in bactericidal effect or virucidal effect would not probably come out, and the organisms or viruses will now dominate. They colonize that area, and the infection is now what you see. So the other one is the allergic, which I said. People could be allergic to pollens and all these other things that is found in dust around the Harmattan period too. And that allergic reaction, there is the appearance of the eye, which is different. But just to let you know more about it, how to treat, and why some people do have it, all questions on the problem of conjunctivitis, I will now go into the slide to do a more detailed explanation and study, especially on the laboratory diagnosis. We need this laboratory diagnosis so that you are not treating wrongly. I have just told you about 3 to 4 types. You can imagine the whole, these different types of conjunctivitis have different treatments. Bacteria are treated with antibiotics. Viruses are treated with drugs that are antiviral. The allergic ones, you probably need to take something that will reduce the reaction, histamine, antihistamine, and then the chemical, I just told you, washing the eye. Then in children, babies, because of the birth canal, you can imagine if a mother has Neisseria gonorrhoea in her birth canal. Babies, because they have no immunity, once they pass through the birth canal with their eyes, they now get infected. That type of infection is called Opthalmia, the neonatorum ophthalmia. It is a serious Neisseria gonorrhea colonization of the eye, and it could cause blindness for the child if not treated on time. Like I said, I'll move into the slide so that the understanding becomes clearer, and you are more you are wiser, and can also help others in understanding the problem they have. So if you like what you are watching, click the like button. If you want to subscribe, you subscribe, because there is no money paid. There is no premium. Subscription is just press the subscription button and you'll be notified. Welcome. The laboratory diagnosis. The causative agent, bacterial, viral, and chemical. Staph aureus, Streptococcus, Haemophilus, and Moraxella catarrhalis are the criteria. In neonates, Chlamydia, trachomatis, and Neisseria could cause Opthalmia, neonatorum, which could even cause blindness. Bacterial lab diagnosis is just involve the microscopy, culture, identification, and sensitivity to know the antibiotics that shall be used for. Then the viral agents are Adenovirus, Picornavirus, herpes virus, Rubella virus. Under the herpes, you have Varicella zoster. Then for viruses, you have to extract the DNA, and after the extraction is the purification and assessment of the DNA. We could also do electron microscopy and tissue culture.